Good evening and welcome, everyone. Thank you for joining our live interactive telephone town hall. My name is Natisha, and I will be moderating this call this evening. In a moment, we will hear from Mayor Tom Mcgee, Lynn Public Health Director Michele Demaris, and local medical experts from Lynn Community Health Center and North Shore Medical Center, who will share information about the ongoing COVID-19 pandemic in our community and the intersecting topics of the latest news regarding the COVID-19 vaccine, the holiday season, testing, group gatherings, and compliance with the state guidelines. We are also offering a simultaneous Spanish-only town hall, which you can join by pressing *0 now. As I mentioned, this is an interactive forum, and we would love to hear from you. We will be taking as many questions from participants as we possibly can live on this event. If you have a question, you can press *3 on your phone keypad at any time, and you will be placed in line to speak with a member of our staff. Or if you are streaming tonight, you can type your question below the streaming player. Now we will hand the call over to Mayor Tom Mcgee for his opening remarks and to introduce the other panelists on the call. Mayor?
Thank you, Natisha, and welcome. Hello and good evening to everyone. Again, this is Mayor Tom Mcgee, and I want to thank you for joining us for the city's third Teletown Hall as we discuss the ongoing risk associated with COVID-19 in our community. The goal of this event is to provide you with helpful information and to answer your questions pertaining to this topic that has affected each and every one of us for the past 9 months. COVID-19 has truly changed the way we all live, work, and play, and live our lives. It's so incredibly important that we continue to take it seriously for the health and well-being both of yourself and for our community during these winter months. You have the power and responsibility to save lives. I'd now like to ask each member of the panel to take a moment to introduce and say a few words about themselves. I want to thank them for being here with us tonight and being part of this evening. And would like to start with Public Health Director Michele Demaris.
Thank you, Mayor Mcgee. Good evening, everybody. Michele Demaris, Public Health Director. It's my pleasure to be your health director and trying to help get us all through this COVID-19 pandemic. I hope that all of you enjoyed your staying in today in your own home and enjoyed the pretty white snow, except for the shoveling part. But welcome, and I hope you enjoyed tonight's teleconference. Thank you. I'd like to introduce to you Dr. Mitch Ryan.
Good evening, everybody. My name is Mitch Ryan, and I am the Chief Medical Officer at North Shore Medical Center. I've had the privilege of participating in a few of these town halls previously, and I hope we can continue to provide helpful information to the community. I've been at North Shore Medical Center for over 20 years. I live on the North Shore, and I am also a practicing OBGYN physician. Barb?
Hello, everybody. Happy holidays. My name is Barbara Lambl, and I'm an infectious disease specialist at Salem Hospital, North Shore Medical Center. I also have lived on the North Shore for about 25 years and had the privilege of serving you at the Lynn Union Hospital for the past 7 or 8 years. And I hope that we can help you with some good advice on how to get through the holidays safely and into the spring while we're waiting for the vaccine.
Hi, everyone. This is Dr. Geoff Pechinsky. I'm the Chief Medical Officer at Lynn Community Health Center and a family medicine doctor. I was born and raised in the North Shore and have been at the health center for the last about 2.5 years. I'm really excited to join you tonight, and thanks for calling in. Hopefully we'll get you some really useful and important information. Thanks. I'd like to introduce Dr. Hanna Haptu.
Good evening. This is Dr. Haptu, and I am the Medical Director for Infectious Diseases at the Lynn Community Health Center, and I have been on these panels before, and I have been with Lynn Community Health Center for 20 years, and it's been a pleasure serving the community of Lynn, and I'm excited about, the forthcomings of the vaccines, and I wish everybody a happy holidays and stay healthy. Thank you.
Great. Thank you all. Thank you all for joining us. And I don't know if there's any questions that have come in. We can maybe jump right into the questions. I do.
Yeah.
Go ahead. Go ahead. Do we have any questions?
We do have a couple that have come in. I just wanted to remind people that if they do have a question and they have called in tonight, that they can press *3 on their phone keypad. If you're streaming online, you can submit a question below the streaming player, and we will try to get to as many questions as possible tonight. And also a quick reminder that we're also offering a simultaneous Spanish-only town hall, which you can join by pressing *0 right now. So jumping into questions, we have one from DW. Is there a timeline for when vaccines will be available for all residents?
That's a good question. I don't know who would like to maybe step in on that. We've been talking with the state, and we're working closely with the local health director to make sure we're putting the pieces in place to make it available to everyone. But if one of the doctors would like to speak up, I know that some of the vaccines have already been happening locally over the last couple of days.
Yeah, so this is Dr. Ryan. I'll give a quick answer to the question, and it's a very good question. We actually don't know the specific timeline yet. We know our strategy, which has been directed by both the federal and state government in terms of how we will prioritize vaccination. But it is my belief that by April, May, we will have vaccinated all of our appropriate staff and patients on the North Shore. And Barb or Hanna, Geoff, I don't know if you want to add anything to that.
Yeah, thanks, Mitch. This is Geoff. I agree with everything you just said. The state does have a rollout plan that's really starting around now to start delivering vaccines for healthcare settings, and then vaccinating healthcare workers, first responders, groups that are responding to the virus, and then as well as people or patients in long-term care settings, and then looking at patients or folks that have are high risk for complications of COVID-19, and then the general public. So, and that rollout for the general public, we do anticipate will be around April at the earliest. Thanks.
Yeah, I would only add that we had some good news today. The advisory panel to the FDA approved a second coronavirus vaccine, which is made by a local company in Cambridge called Moderna. So right now, the federal government has purchased, I believe, 400 million doses between the Pfizer vaccine and the Moderna vaccine. And yes, they're going to be given out in order of priority, as Dr. Pechinsky just outlined. So we're hopeful by the spring, citizens will be able to get their vaccine, and it's going to be free vaccine. So that's the other exciting piece of news.
Hi, it's Michele.
Dr. Oh, sorry.
No, go right ahead, Dr. Haptu.
So just to add a little bit, to make it a little bit expansive in terms of when, and I know, our audience may also be under the phase 1, which is phase 1 is basically all clinical and non-clinical healthcare workers, anybody that works in a hospital in different modes that is comes into face-to-face with patients. That would be in phase 1. Police, fire, emergency, patients living, congregate housing. In nursing homes and home health care workers. Those would be the one right now with phase 1. And so the other phase 2 is the high risk population. including older adults, 65 and above, early education, K to 12, grocery, utility workers, agricultural workers, sanitary, public work, and public health workers. And so this would be the phase 2, and then the phase 3, which April to June, that would be the general public, the general public. So just wanted to have some clarity on that.
Hi, everyone. It's Michele. I would try to encourage all of you to please give serious thought to the vaccine, as we all need to be considerate of each other and to try to protect each other and protect ourselves from this horrible virus. So I can't wait till I'm first in line, I hope, somewhere, April or May, and to be able to take the vaccine. So I would like to encourage all of you to please give it serious thought and line up and get the vaccine. Thank you.
Thank you, Michele. And I know there was a couple of poll questions that will probably relate to that, but I'd just like to echo what Michele had to say. And maybe it's an important point for some of the medical panelists on here to talk about the safety of the vaccine as well as the effectiveness of it. I will be, when it's available I'm in the category to get the vaccine. I will absolutely get the vaccine. My family will get the vaccine. And I think it's important as a community that we talk about that and make sure that people understand the safety and the effectiveness of it. So I don't know if the panel wanted to weigh in at this point on that, because I think that's really on everyone's mind, and it's been becoming more and more of the discussion both locally and around the country as the vaccine starts to become available.
Maybe I can start. So these 2 vaccine trials that have gone so far have enrolled, between the 2 of them, about 75,000 people around the world. And half of them received the placebo, of course, which is the non-vaccine injection, and the other half received the vaccine. And so far, and it's been about 6 months since these trials have started, so far, the only side effects the most common side effects, I should say, have been headache, fatigue, and a sore arm, no more than you would get with any other kind of shot, including your flu shot, your annual flu shot. There were reports so out of those 30,000 people who got the vaccine, none of them had any major side effects, except the 2 patients that we heard about in England who had the anaphylaxis, but they also had a long history of severe allergic reaction. So the CDC has actually come out and said that if you have minor allergies, you don't need to worry. If you do have a history of anaphylaxis to any vaccine, then you should talk it over with your doctor before you consider getting this particular vaccine. But I think for individuals in general, I think we really have to think, what is the benefit versus the risk to me? And the risk is very, very low. Only about 7 to 10% of people have had any adverse event at all, and most of them were extremely mild. And the benefit is that you can escape a deadly disease, and it has killed a lot of people, not just older, vulnerable people, but also very young people have died of this in our hospitals.
This is Dr. Haptu. I just want to add to what Dr. Lambl said. The effectiveness of this vaccine is unseen or unheard from prior vaccine histories. So it's about 95% effective, both vaccines. And how they came up with that is out of those 30,000 or so people that got, especially like one of the studies from Moderna, out of, let's say, 15,000, about 165 out of I'd say 40,000 that they had 165 positive COVID for those that were not vaccinated in that unvaccinated group. But the vaccinated group were only 11. And they never had also any major complications, but the unvaccinated group had major complications from COVID. So the effectiveness of the vaccine is, incredible and unheard. And so, it becomes, flu vaccine is not as 95% effective. We get 50 to 75%, effectiveness, and we still take it every year because it has benefits still. So what I would like to, ask our listeners is that this is a highly effective vaccine, especially both of them that are coming up, and it would be there's such a thing called herd immunity. That's where we want to get there. The more people, at least about 70% of the people or the population has to have the vaccine to mount a herd immunity. Otherwise, the other herd immunity is by getting infected and getting sick, and that's not what we want. And so we encourage all citizens of Lynn that are, to be vaccinated when the time comes for it to be, to get the vaccine.
Sure. So this is Dr. Rein. I'll try and keep my comments brief, but I will be getting the vaccine as soon as it's my turn. I expect that will be over the next month, maybe a month and a half. We've started vaccinating at North Shore Medical Center the last couple of days, and I've spoken to and seen some of my physician colleagues. Other than a little bit of shoulder soreness, I haven't heard any complaints about the vaccine. All of the physicians that I work with are planning to get it. I actually have not heard anyone suggesting that they're going to wait. And, if you're interested in seeing some of the testimonials, we have a Facebook page. I saw one note today from one of our environmental services employees, and I won't mention her name, but she lives in Lynn. She was interviewed after her vaccination. And, part of what she said is, I'm doing this for my family, coworkers, and the Lynn community. I want my community to join me. I want to show others that I'm not afraid, and hopefully they'll get it too. So I agree with the other comments. All of the data suggests that the vaccine is highly effective, extremely safe. Although, it was developed rapidly, we have a lot of evidence that FDA went through their normal process. No corners were cut, and I'm very comfortable and confident recommending the safety of the vaccine.
Thank you, Doctor. And I think we'll go to maybe some more questions. I think there's more questions that actually are related to the vaccine.
Yes, there are. The next one actually comes from Laura. Is it known yet if the COVID-19 vaccine will be once for life, or every 10 years like the shingles vaccine, or annually like the flu vaccine?
I can start with that one, and I know my colleagues will have additional information as well. It's a great question. So we know with this, first, just to add the commentary that with the Moderna vaccine, one that was mentioned a little bit earlier, it's 2 doses, one and then 28 days later. And that first shot really kind of primes the immune system. We know there's evidence it starts working within 2 weeks, and that second shot really even boosts the immune response more. What we expect is that COVID virus, like influenza, will become endemic, and it will be an immunization that we're expecting each year somebody will get. We don't know that for sure, but that's what some of the thinking is pointing us toward. My understanding is every year, but I'd be interested what my colleagues have to say too. Thanks.
Yeah, Dr. Pechinsky, this is Barb Lambl. I think you're right. I think we really don't have enough information at this point to really say for sure, but we know that with other coronaviruses, this is a coronavirus, and there are probably 60 different types of coronaviruses, usually cold type illness in children. We know that they're not immune to a second infection. So we are concerned that the same thing will hold true for this bat coronavirus, the SARS-2 coronavirus that's causing COVID-19. We are concerned, and I think the FDA is studying this very clearly, very closely. They're following this. In fact, they will be following people for 2 years, people who get the vaccine in the study, to see whether they become ill with coronaviruses later on, years later. So I think the jury is still out on that, and more work is being done for follow-through.
So this is Dr. Haptu, just to add to what Dr. Lambl, Dr. Pechinsky said, that these vaccines, they think probably would last 4 to 5 months in terms of, rendering immunity. And so that's why we don't know even if this is going to be a seasonal, disease or infection, or it's going to be a year-round. So there's a lot that we don't know. But I think the key is just to get the vaccine when it's available.
Thank you.
Right, we got to put an end to this pandemic, so we want as many people vaccinated as possible so that the herd immunity goes up and and the epidemic is cut short.
Great. Well, staying on the topic of the vaccine, Kelly actually has a question. How do we decide on which vaccine to take?
This is Dr. Haptu. I would take that up. So it's going to be what is available to the area. At this time, we have the Pfizer vaccine, and hopefully next week we'd have the Moderna vaccine. And there are others in the pipeline, such as the Oxford vaccine and the Johnson & Johnson. So these are still being studied, but we assume that maybe in a few months they would be available. So it depends on what is available. And we just whether it is if the others are available earlier on, the half-life and the storage and stuff tends to be a little bit easier than the ones that we have now. And so it depends what is available and what the state wants to purchase.
It's important though too. Oh, I'm sorry. Go ahead, Mayor McGee.
No, go ahead, Michele.
I think, too, it's important to remember that if you get a Moderna vaccine, your second dose has to be a Moderna vaccine. If you get a Pfizer vaccine, your second dose has to be a Pfizer dose. You can't mix the two. If you start with Moderna, you finish with Moderna. If you start with Pfizer, you finish with Pfizer. But I think, again, it's important that once they are available to all of us, that we all line up to have the vaccine.
And I'd just like to maybe can follow up. One of the panelists would like to answer. So I think the question probably leads to, is one better than the other? And again, we're talking about safety, and the studies have reflected that these vaccines are all going to be highly effective. So maybe that is something someone would like to speak to.
That is true. They're 94 to 95% effective, the two vaccines that we have now. So I don't think you have to, worry about which one will give me more protection. There is. I know I'm going to get the first one that's available to me, so I'm waiting to sign up. So it doesn't matter. Moderna, Pfizer, whichever one comes first, that's the one I'm going for.
Yeah, this is Dr. Haptu. Sorry. So to add to what Dr. Lambl said, basically, and the side effects are basically similar, which were very minimal. And so, whatever is available.
Dr. Rein?
This is Dr. Lynn. The only thing that I'll add is your personal physician and or wherever you receive your health care, they'll obviously be having a discussion with you. Your best interests will be top of mind, and it really will be a shared decision between the patient and their provider.
So,
Great.
in terms of second dose, whoever is providing the vaccine will make sure that you get the same vaccine and not they're not interchangeable at this time. So, if you are coming to Lynn Community Health Center, then you got the Pfizer. Definitely, your second dose is going to be Pfizer. So, whoever is administering the vaccine will, keep track of that.
Great. We do have go ahead, Mayor.
I was going to say, Natisha, maybe it's before we jump into another question, because I know we have two poll questions. Maybe we can get one of those poll questions out, because I think they're both irrelevant related to the vaccine. So, and then we can jump to another question.
All right, let's jump to a poll question then. We would like to hear from everyone. We're going to ask the quick poll question. So if you're on the phone, you can vote by pressing the corresponding number on your keypad. If you are online, you can vote by selecting your response below the streaming player. So our first poll question this evening: when will you be comfortable to get a COVID-19 vaccine once it becomes available? Press 1 for as soon as possible. Press 2 for after a few people I know have taken it. Press 3 for after many other people have taken it. Press 4 for never, and press 5 if you are unsure. So while we are waiting for those results to come in, our next question is actually from Ryan. Regards to the increase of cases of COVID, will there be a mask mandate outside of the house?
There is one at this time. There is one at this time.
Right. There already is a mask mandate. You want to speak to that, Michele, in terms of the mask mandates?
Yes.
You
should be wearing your mask when you're, to go into a store, when you're out in public. I know that previously it was said that if you could stand 6 feet away, but now everybody's recommending that while you are outside and not in your own home base, that you wear your mask at all times. So there is a mandate for outside. In stores, if you're in meetings in your office, and there is a mandate that you should be wearing your mask at all times.
And just to follow up on that, just to follow up, Michele, and then you can, the governor's mask order is in effect. A mask needs to be worn whenever anybody's in public, regardless of distance. So that has been something that the governor has had in effect for a number of weeks, I know for sure. I'm sorry, Michele, you can follow up on that?
No, and then I was just going to say that he also had recommended, and it is also recommended, that you wear your mask in your own home, just especially now while we are in such a dramatic surge.
I'd just like to emphasize, this is Dr. Lambl, I'd just like to emphasize that masks really have been shown to work. There was a lot of skepticism at the beginning, but a very good study out of the CDC showed that if one person wears a mask in a two-person interaction, that person is protected about 48% of the time. If both people wear a mask, then there's 80% protection from the virus. And it doesn't have to be a medical-grade mask. It just has to be a 2-layer cloth mask that you sew at home. So masks are extremely effective. This is a respiratory virus. The primary way it's spread is from person to person through breathing, coughing, sneezing, talking, singing, all those activities that we've heard about on the news, singing in choir, singing in church, eating at the same table. And masks are really, really important. Even outside when you're exercising, the governor's mandate from November 6th was posted in the parks locally, and it says, even when you're outside exercising, wear a mask to protect the people around you and to protect yourself.
This is Dr. Pechinsky. I just wanted to add to that. One difference right now is we have plenty of masks too. I know earlier in the pandemic that was a concern, and that supply chain is restored. We have masks. People can purchase masks. I think if people are coming to be seen at the health center, we're giving everybody who comes in a mask to keep themselves and the people around them safe. So just to reiterate that definitely to wear a mask.
This is Dr. Haptu. Just one more thing. I see so many people on the street with the mask under their nose, and it's just that's not appropriate, and we need to put it up our nose and wear it appropriately to be effective.
There are also people, too, that I see who have it, under their chin, or they have it around their neck. If you're going to go to that length, it's important that you wear it the proper way, where it covers your mouth and it covers your nose. That's the important way. And I do hope that if you see people who aren't complying, that you will at least call them out on it to say, please wear your mask appropriately.
Right, and it doesn't have to be, a big deal like a scolding or I'm better than you type thing. It can just be a little cue, a little physical cue. I was doing my constitutional morning, and somebody was jogging by me without a mask on, and I just pointed to my mask, and next day I saw the same person, and they had a mask on. So it doesn't have to be a huge to-do. It can be just a little sign that don't forget, wear your mask.
Great, thank you. The results are in for our first poll question. The question was, when will you be comfortable to get a COVID-19 vaccine once it becomes available? 48% said as soon as possible. 17% said after a few people I know have taken it. 17% also said after many other people have taken it. 3% said never, and 15% said they were unsure. Mm-hmm. So, what do you think about that?
What was the percent? What was the percent of unsure?
15%.
15. Okay, 15. Okay.
40. For the 48% of you, I'm with you. As just earlier, I had said that it would be April or May, and Dr. Pechinsky had texted me and said, "You're in phase 1, January, February," and I'm very excited now. So thank you, Dr. Pechinsky, for that wonderful news, because I think that the quicker everybody will get a vaccine and to develop the herd immunity, that we could all at least, I don't think there'll ever be a normal kind of life, but at least we could go back to some sort of normalcy that we know. And I think that it's important to try to encourage everybody to take the vaccine.
So this is Dr. Rein. One of the things that I would add is that we know that some of the populations that are at the greatest risk of severe COVID disease, those patients that need to be hospitalized, the patients that end up in the intensive care unit, are the populations that seem to be the most resistant to vaccines. So maybe that 3% includes some of those patients that are at highest risk. So it's another reason for all of us to help educate the community at large about the safety of the vaccine.
And I think to follow up on where we're at and how we get to a better place, and just understanding what's been going on here in Lynn, the latest case numbers are really jumping out at us today. 130.4 cases per 100,000 per day. That jumps up from 67.6 per 100,000 14 days ago. That went to 89.19 per 100,000. We're now at 130.4 cases in Lynn, over 10,000 cases in the city of Lynn so far during this pandemic. 13.74% positivity rate, under 5% or closer to 3% is the goal. We have been really hit hard by this. We've really, in a terrible way, have lost 146 people in our community to this pandemic, to this virus. And so not only with keeping wearing masks, and that's been clearly articulated by some of our experts on the call, social distancing, keeping small numbers in the homes, and being smart in terms of the indications from CDC and all the experts. The vaccine is our way to really get past this terrible time. And so I think it's so important that we understand what's happening here, and I know we do, but it really is something that can help us get to where we all want to be together. So I just wanted to lay those latest numbers out so people understand the continuing challenge we face in the city of Lynn.
And this is Dr. Oh, sorry. This is
no,
Dr.
go ahead,
Haptu.
Hanna.
I just want to say that kudos for the 48% and then the 34% that want to wait. And I just want to make sure those of you that are in phase 1, meaning that those of you that need to be vaccinated between now and February, the people that work in hospitals, that are in direct patient care, people working in long-term facilities, the police, the fire, the emergency services, the congregate housing, people doing home health care, we need to have you vaccinated. And so I just want you to think about that. The data is there. The science is there. The vaccines are safe and effective.
Okay. What I'd like to do is...
Mr. Mayor, can I say one thing?
Sure, definitely, Dr. Pechinsky. Go ahead.
I wanted to go back to the numbers you were just talking about, that at the health center where we're doing testing about really 400 to 500 a day, we're running about 20% case positivity for the city of Lynn, so for residents of Lynn. So I think that number jumps out at me as well. And I think the message around just the case positivity rate is we're a few weeks after Thanksgiving now, and we expected after Thanksgiving a jump. And so I think it's lessons learned in that for the upcoming holidays to stay at home. And it's hard to visualize, I know, but we're getting there. We're really getting there. There's a vaccine coming in the next month, but to really bubble with the folks you have been with, and not be in big settings with large amounts of people. So I just wanted to reiterate that as well. Thanks.
Thank you, Dr. Pechinsky. I know we could continue on this. I know there's several more questions, and I think the second poll number, again, reflects on the vaccine and what people's perspective is on that. So I think we can maybe jump into that if that's okay, Natisha, and then to a couple of other questions. Okay.
Yeah, I'll ask the next poll question, and then from there we'll jump into a couple other questions while we're waiting for our results. So remember, if you're on your phone, you can vote by pressing the corresponding number on the keypad, and if you're online, you can vote by selecting your response below the streaming player. Our second poll question this evening, which source do you trust most regarding the COVID-19 vaccine? Press 1 for my personal doctor. Press 2 for the federal or state government. Press 3 for local elected officials. Press 4 for local faith leaders. And press 5 for friends, family, and neighbors. So while we're waiting for those results to come in, our next question is from Jeannie. I know we were just talking about testing. Well, Jeannie wants to know, are COVID testing site hours, are the hours of operation changing for next week?
Yes. Hi, it's Michele. Next week, the two Stop the Spread sites, the one at Lynn English and the one that is at the Federal Street parking lot, they will be open Monday and Tuesday, regular hours. Lynn English is 8 a.m. to 2 p.m. The Federal Street lot is Monday and Tuesday, 12 noon to 6 p.m. And on the 23rd, which is Wednesday, they will be working only 8 a.m. to noon, both sites. And they'll be closed Christmas Eve and Christmas Day, but they will be open again on the 26th. And I'm sorry, I don't know the Lynn Community Health numbers, but I'm sure Dr. Pechinsky or Dr. Haptu will let us know.
Yeah, thanks, Michele. Yeah, just getting off mute there. So for next week, the 21st and 22nd, we're open from 8:30 a.m. to 7 p.m. The 23rd to the 25th, we're closed. The 26th will be 11:30 to 4:30. The 27th will be closed. The 28th and 29th, the following week, 8:30 to 7 again, and then the 30th through the 2nd will be closed for testing. This information, just I don't know if people are trying to scratch that down, but is all, if you look up Stop the Spread Massachusetts, you can find Lynn and find all the sites and the times that were open on there.
Thank you, Dr. Pechinsky. And I'd like to just talk about another testing that's going to be beginning, I think, on possibly the 22nd, but definitely on the 23rd. It's the Project Beacon, which is Lynn is one of 3 communities where that the new testing will be made available. It's by appointment only, and the information will be available. So that I just want to leave that out there. And I also want to say that we have all of that information on the city website, on the COVID-19 section of the city website. So you can check that out, and all the information you need to know on testing, on what's going on the data, on the cases that we're seeing, resources. We really have a lot of information that's available. So the City of Lynn website is definitely a location where you can also get that information, and we'll be highlighting clearly the information over the next day or so related to the Project Beacon testing, and that will be at the Blossom Street extension, which is down where the ferry location, the parking lot down there off the Lynn. So we will get that information, and it will be available both publicly in many areas, but also on our website.
Great,
and the results on that we anticipate would be within 24 hours. So that would be when those tests come in, which is an important part of that. And I know there's questions, but I know on the Beacon, on the new testing location, that it'll be at 24 hours. It's an appointment online, so you make it online, and there's going to be a substantial increase of opportunity there once that gets up and running.
Mayor, that site is up as a drive-through also. You don't have to get out of your car, and they expect to do up to 2,000 tests a day, which is such an improvement for us.
Yeah, that's the goal, and that's it's going to ramp itself up, but it's a drive-through, and the sites that are happening, I know in Revere, that it's by appointment only, so it's going to be something that's a much easier opportunity to flow through. A lot of people can get through that, and then it'll be hopefully much more accessible and a good complement to what's going on at the Lynn Community Health Center.
Staying on the topic of testing, David has our next question, and he wants to know how can we be rest assured that these COVID tests are as accurate as possible?
So this is Michele, but I'm going to let the doctors take care of that. It has been shown that the PCR test, which is the nasal test, is the most effective rather than a rapid test. So I would recommend that you take the PCR test, which is the nasal swab test.
Yeah,
who on the panel would like to speak to that? Go ahead.
Sure, this is Dr. Lambl. Yeah, I agree with Michele. The nasal PCR test is the most accurate. test of all of them. The saliva test is almost as good as the nasal, as long as it's a PCR. The rapid nose test is not accurate at all. We don't recommend it.
Any other thoughts, or we can go on to another question? Go ahead, Dr. Pechinsky. Go ahead.
I think the only thing to add is that it's the PCR is the test that we're doing at all these sites, and so it is the most accurate. And the turnaround time is still, the lab is doing an amazing job, 24 to 48 hours tops, it seems, even with the higher numbers of testing. So that at this point is still the recommended test.
And I would like to just add one thing. It's Michele again. I think it's important for everybody. I've been tested 5 or 6 times. I try to make it a point to go at the 14th or the 15th of the month and then the 30th of the month. And it just gives you an idea as to where you are every 14 days. So I think it's important that everybody at least try to just go get a test, because you could be saving someone's life with the test. So if you can, I do highly recommend, the testing is available, it is free, and I think it's important that we all should be tested just even to have a baseline.
So this is
Dr.
Dr.
Haptu, sorry.
Yes, Dr. Rein.
I just wanted to add to the testing. At the health center, I'm sure other sites are doing it also. It's a self-testing. You just did it at the tip of your nose. Nobody has to shove that thing down there anymore, and it's very easy and painless. And so it has become very simple, but it's a PCR test.
So this is Dr. Rein. I'll just add another comment. David, good question, because I think even with the best test, it's not perfect. So if you have symptoms, then you should isolate. You should not go to work. And particularly some of the new onset symptoms, particularly, people that have experienced a change in their taste or sense of smell. We know that that's very sensitive, even if the test comes back negative. And then the only other thing that I'd like to add is just the importance of doing what you can to stay within your home bubble. And this comment may sound a little bit insensitive, but if your children do not live with you, you should stay away from them, because what we know is this rapid increase in testing, it is affecting way more people less than the age of 60 than above the age of 60, but it is the older population that is more likely to get ill and ill enough to come into the hospital. So I just wanted to make that point about symptoms.
Well, we do have the results to our second poll question for the evening. The question was, which source do you trust most regarding the COVID-19 vaccine? 74% said their personal doctor, 11% said the federal or state government, 4% said local elected officials, 3% said local faith leaders, and 8% said friends, family, and neighbors. We do have a couple more questions to get to this evening, but any feedback on those poll results?
I'd like to say something. I think glad to hear that people's personal doctors are highly regarded, and I think that's why it's important that we've been able to do during these teletown halls. We've had some, the panelists have been more than willing to be on these calls. They're local medical leaders and experts, and I really want to thank them for being part of this. And I think it just lays out the importance of the continued input and opportunity to hear from the medical profession, and obviously your personal doctors in terms of what you need and how important this is. So I think that's so we'll continue to make sure that information comes from the medical community in Lynn and on the North Shore. I don't know if any of the doctors would like to speak to that, but I I think that's positive news in terms of the messaging that's coming from medical leaders.
That is very encouraging.
Yeah.
That makes me feel good. And thank you very much to the citizens of Lynn for placing such high confidence in the medical profession. And just so you know, yes, we individualize. We care about each individual patient, and we individualize our recommendations based on what we know about your specific situation, your medical situation. But we also stay on top of all the latest scientific developments, and we go with the science. And the science has really outdone itself this year in terms of the rapidity and the success that the scientists have had in bringing a new vaccine to life. Yeah. So thank you very much to the citizens of Lynn for that vote of confidence.
This is Dr. Haptu. I just want to second that what Dr. Lambl said. Thank you for honoring us, and I think you validate our purpose or our jobs. And our job as physicians or healthcare providers is basically taking care of you and protecting you for any illnesses. And so I really do appreciate that. And also the other federal, local, or state, they're also your advocates. And so have a little faith in that also. But thank you for honoring us.
Great. Jumping back into to some questions, we do have one from Sheila, and she wants to know what the experts think about bringing students back into school, into the schools for in-person learning.
What is the timeline? When we're talking about right now?
I think that's a good question. I think it's the timeline is now, or I think looking at the data and reflecting on what's happening both in the city of Lynn and elsewhere. So I think that's probably what the question relates to. But I think it's probably what's happening at this point and what we're dealing with now. Seems to me that's probably the question.
I actually did just hear from Sheila, and her response was January 19th. So probably when the kids go back to school after their break.
So I think I would assume that the state and the cities would make the decisions based on what the rate of infection is. And so the news is that right now it is really high. The infectivity rate is really high in our community. And we expect to be even higher after the holidays, meaning, Christmas and New Year. So we just have to look at that.
And this is Dr. Pechinsky. I just wanted to echo what Dr. Haptu said. I think we need to look at a local level and see in different communities what the case positivity rate is, and weigh it by that. And it's such a complex, it's a great question. It's so complex because obviously if people can't work because their kids are at home, the governmental leaders and school leaders need to weigh all that. But I think right now in the midst of the pandemic, it's really the number one factor is I think children's safety and then family safety. So, right now with the case positivity rate that it is, I think it's still that kind of home for school or remote learning is what we're recommending at this moment. And just a second piece to this is we're very optimistic, right? We're the first time in a long time, I feel like, where we're talking about vaccine, but that also doesn't mean that, as we start to roll this out next month or so, that we can go back to school or can stop wearing masks or stop social distancing. It is going to take a while for, somebody had mentioned that herd immunity earlier. It's going to take a while for enough people to get the vaccine where we can start. It will be in phases and kind of start relaxing some of those. So we're not there yet. But
I think this is Michele.
Yes.
Go right ahead, Dr. Haptu. No, you can.
No, I just was going to ask. the education, K to 12, that's in the phase 2 of the vaccination series. So that would be between February and April. So, we may even start vaccinating some of these kids by then. I think there is a light at the end of the tunnel going on pretty soon.
I do think that at this time it's not safe, and as Dr. Pechinsky had said earlier, we have a 20% positivity rate, and once you put all the children back in school, yes, with the mask and hopefully 6 feet apart if that's feasible, but I think that all of a sudden now you've broken this bubble and you've just swamped everybody together. So I just think it's a better idea to try to do it gradually when it is safe, when the numbers are down, when a vaccine is in place, and I just think it's safer for everybody in that respect.
Great. Well, we do have one last question that we wanted to get to this evening. So it is from KK. Is the city of Lynn back to the original phase 2, step 2 guidelines, or is it modified and we only follow the modified version?
It's modified, but I'm happy to answer that. It's modified, but it pretty much follows what the original phase 2, step 2 regulations were, and for those that are on the call, so we joined Boston, Newton, Somerville, Arlington, Winthrop, and Brockton, who took action related to that. And based on and I laid out the numbers earlier, we really are seeing such an increase and the impact in the city. We've been a high-risk red community pretty much from the beginning of this pandemic, and so taking action was really important, particularly with what we continue to hear, and I'm glad to see people are supporting their personal doctors, and what we continue to make us decisions based on the medical experts, the scientists, the epidemiologists, into what is important and how we can try and limit the spread here in the community. I know there's concerns with the hospitalizations continue to rise, and a piece of that is not only are there beds available, but is staffing available, and that's different than the spring when we had a lot of traveling health workers that were able to come here, as most of the country was not impacted as the Northeast was. So we did roll back, we did step back, return to phase 2, step 2, and it addressed a number of key priorities there, and I know we're almost at the end here. The 2 orders have been posted online at our website, but it limited indoor recreational and athletic facilities for the general use. Limited outdoor event space used for gatherings and celebrations, 25 people or less. Again, I think that allowed down to 10 people or fewer in indoor and non-athletic instructional classes and arts education and life skills for persons over 18 years at indoor recreational venues with potential for low contact. Again, being inside, and I think maybe some of the panelists can speak to this, batting cages, driving ranges, bowling alleys, and rock climbing. It really is something that, we continue to hear from the scientists and the experts. Indoor close gatherings are really causing a problem, and really what we're trying to do here is to limit the gatherings to the people that are inside our own bubble, and we really need to follow that. And I don't know if any of the panelists would like to speak to that, but I think that's clearly the piece. And the full phase 2, step 2 is on our website and our resource page, and you can check out the orders and exactly what that means to what we're doing in Lynn. But if any of the panelists would like to speak to the gathering part of it in particular, and the indoor impact of being indoors in close contact in many situations.
Hi, it's Michele. I would echo what Mayor Mcgee had said concerning the gatherings. I think it's so important that we pay attention and try to follow that, okay, in my household there's 2 people and that's who I'm spending Christmas with. And there's 4 people, then I'm only spending Christmas with those 4, because that's the important part. Christmas, yes, it's always December 25th, but there's no reason why we can't celebrate it in July, Christmas in July. I think that it's important to note that just because the holidays are now doesn't mean that you have to run and I know people say, well, I'm with my family. You're with your family that you don't live with. So it's important to try to grasp that idea and to, like for Thanksgiving, you had a Zoom giving. Maybe at Christmas you could have it so that when you're opening your gifts that you share that with the rest of your family. I would just highly encourage all of you to please, please stay in your own homes. Thank you.
And this is Dr. Rein. I would just echo that as well. It really is everyone's responsibility to, do what they can to help us move to the end of this pandemic in the shortest amount of time as possible. We talk about flattening the curve, and we know that everyone doing their part will help us in that regard. It's a big sacrifice, but it's a bit of a down payment. It's been a really difficult year for all of us, but next year will be better, and we'll be with everyone together in a much more joyful way.
Well, we are coming to the end of our live event this evening, and I'd like to thank everyone for taking the time to join us for this important City of Lynn Tele Town Hall on COVID-19. We appreciate the opportunity to speak directly with you and answer your questions. I will now turn it back to Mayor Mcgee for his closing remarks this evening. Mayor?
Thank you very much. And again, thank you all for joining us this evening. I want to thank the guest panelists on both simultaneous town halls for taking the time to be here tonight as well. I hope this was informative for you and your families on how important it is to continue to stay diligent and follow the guidelines to stop the spread of COVID-19 within our community. And again, I just can't thank the panelists enough. They've been on several of these teletown halls, put the time out of their busy schedules to be on and to help us really get the answers to some really tough questions that we're dealing with, all of us are dealing with together. There are several ways to stay informed and up to date on COVID-19 in the city of Lynn. You can follow my Facebook page, Tom Mcgee, Mayor of Lynn. You can visit the City of Lynn's COVID-19 resource page on our website, lynn.gov/COVID-19/resources, or sign up for our city's Smart 911 alert system by going to smart911.com. This winter surge we are currently experiencing is widely believed to be the worst part of this pandemic since it began to affect us back in March. Lynn residents need to be more diligent than ever in following the protocols that we've outlined. This has been stressful and unprecedented year for all of us. And unfortunately, the holidays over the next few weeks will be no exception. We've already witnessed how quickly cases can jump when people gather together outside of those in their immediate household for Thanksgiving. I implore you and your families and friends to listen to the healthcare leaders you've heard from tonight and abide by the COVID-19 guidelines during Hanukkah, Christmas, and New Year's. I know that these continue to be challenging times, but if we continue to make these sacrifices now over the next few months, we will get through this together. There is light at the end of the tunnel with vaccines already starting to be administered in the United States and here locally, as you've heard tonight. And I know that we can work, this really is important, together we can work through this with less sickness and less loss as we follow the recommendations of the health experts that we've heard tonight and continue to listen to. Thank you all for taking part in this call, and hopefully you will stay healthy, stay safe, and really stay diligent on following the guidelines, and hopefully you'll be able to have a happy holiday, either remotely and safely with your family and friends. Thanks again, and good night.